Hi, I'm Catherine Watson. I'm an elder care advisor and a life coach, and I work with people like you who are probably listening to this right now to find out what are some alternatives to the typical nursing home. If you spend any time at all in a nursing home or a skilled nursing facility, as most of them are called now, you probably don't want to spend a whole lot of time there. The food is usually not the best. The care level is not the best. People will often sit on their buzzers for a long time before they get any assistance at all. There's just too many patients to the number of caregivers. It's just the ratio's not good. And there are alternatives, but oftentimes you're not told that. The social worker doesn't tell you, the case manager doesn't tell you for various different reasons. And a lot of times people think that the skilled nursing facility is their only option. If you are private pay, that means you do not qualify for Medicaid. And I'm talking Medicaid, not Medicare. Medicare is not going to pay for your long-term care. If you thought they did, I'm sorry to tell you, they do not pay for long-term care. They'll pay for short-term stays for rehabilitation purposes. But when your time is up, you've got to get out, or you've got to start paying. And if you start paying in the skilled nursing facility, expect that bill to be anywhere from $7,500 on up. And you may have to pay ancillary charges for additional services or products. So that's a lot of money. And if I'm going to spend $7,500 on my parents' care, I want the best. How about you? I want really, really excellent care. So there's some alternatives. And of course, it's going to depend on your situation. But most of the time, most of the people that are in nursing homes could do just perfectly fine in a good assisted living or a good personal care home. They would probably do a whole lot better because they're going to have a higher level of care. They're going to have a quicker response time when they do call for help. They're going to have more engagement, better programs, better activities, things to engage them and keep them active and alive. In the personal care homes, a lot of them are really all about giving good, wholesome cooking. Some of the personal care homes even go so far as to serve organic food and really are careful about the foods that they serve the people because they've got a small home. They may have anywhere from 6 to 12 people there that they're serving, not hundreds of people like in a skilled nursing facility. So they're getting home-cooked meals. They're getting a lot more engagement. The staff-to-patient ratio is a lot better in a smaller environment. You usually, interestingly, will pay about half the price that you're going to pay at a nursing home. Maybe a little bit more, depending on your area of the country and what's available. But typically, it's about half. Even if it was a third less and you got a whole lot more engagement and services and better food, even if it was the same price, it would be worth it. So there are options. And I'd love to discuss those options with you. I'd love to help you find those options. My name is Catherine Watson. If you want to call me, I offer a no-charge complimentary consultation. We'll just chat for about 30 minutes, and I'll give you some information. We'll decide from there how we want to proceed. If you live in the Houston area, I do also offer placement services in this area, and that's absolutely no charge to the family. I'd love to help. My name is Catherine Watson. My number is 281-827-7090. Give me a call sometime. Thanks.